Hi everyone, welcome to another video of NS Pharma. Today we will discuss about important multiple choice question from the chapter Antiepileptic drugs from the Pharmacology. So this is very important chapter, anti-epileptic drugs. Most of the pharmacist competitive exam have 2 or 3 questions from this chapter itself. So study this chapter very carefully and try to understand all the drugs, mechanism of action and side effects also, and also drug of choice. This is very important. So we will move to the first question of this chapter. The first question is the most probable mechanism of anticonvulsant action of phenytoin. The mechanism of action of phenytoin is the question. Option A, facilitation of GABAergic inhibitory transmission, hyperpolarization of neurons. Option C, interaction with the calcium ion channel to promote calcium influx, prolongation of voltage sensitive neuronal sodium channel inactivation. The correct answer for this question is option D, prolongation of sodium channel inactivation is the mechanism of action of phenytoin. We will see the different mechanism of action of different anti-epileptic drug here. Before that, we will see the epilepsy, classes of epilepsy. What are the major types of epilepsy? One is generalized seizure. One is generalized seizure. Hope you can see this one. One is generalized seizure. The second one is partial seizure. There are 2 types of seizures. One is generalized, then second one is partial. In generalized, they are classified into generalized tonic-clonic seizure, GTCS, generalized tonic-clonic seizure, or major epilepsy. Major epilepsy, it's also known as major epilepsy or grand mal epilepsy. Grand mal epilepsy. These are the different name of GTCS, generalized tonic-clonic seizure. The second type is absence seizure. It's coming under generalized seizure, absence seizure. It's also known as minor seizure, minor epilepsy or petit mal. Here it is grand mal, this is petit mal. Then the third one, atonic seizure, atonic seizure or akinetic seizure, Then the last one means the fourth one, myoclonic seizure, and the fifth last one of generalized seizure is infantile spasm. Why I am saying this one is, normally in the question paper it will come. I am not going to describe all these things. In the question it will come, what is the drug of choice for GTCS? What is the drug of choice in case of absence seizure? What is the drug of choice in case of minor epilepsy? If you studied absence seizure, you can understand that by studying this one, you can understand minor epilepsy is a absence seizure. So this drug of choice will be the same. For that only I am just describing this one. I am not going to describe in details. The infantile spasm is also known as hypsarrhythmia. It's also known as hypsarrhythmia. The partial seizure is classified into simple partial seizure and complex partial seizure. And the third one is secondarily generalized simple partial seizure or complex partial seizure. Secondary simple partial seizure or secondary complex partial seizure. These are the different classification of seizure. Now we will see the first question. We studied this one. Mechanism of action of phenytoin is through sodium channel inactivation, prolongation of sodium channel inactivation. The second question, the following anti-epileptic drug is most likely to impair learning and memory and produce behavioral abnormalities in children. Options: valproic acid, phenobarbital, phenytoin, ethosuximide. The question is, the anti-epileptic drug which causes impair learning and memory and produces behavioral abnormalities in children, especially below 3 years. The correct answer for this question is phenobarbital. This one we have studied in case of sedative and hypnotics. There was in that my video, there is a question, what is the current use of phenobarbital? In that question we discussed it. The correct answer was anti-epileptic drug. But here you can see this can cause impair in learning and memory and produces behavioral abnormality in especially in less than 3 years old children. So we will move to the next question number 3. So here we studied phenobarbital causes impair learning and memory and produce behavioral abnormalities in children. Question number 3. Phenytoin appears to derive its anticonvulsion action. The question is repeated from the same as the first question. Here also the mechanism related question of phenytoin. Options are selective inhibition of high frequency neuronal discharge, selective inhibition of epileptic focus, selective inhibition of T-type calcium current in the brain cell, and last option, selective enhancement of inhibitory transmission in the brain. The correct answer for this question is neuronal discharge inhibition of high frequency neuronal discharge. We will see the different mechanism action. These anti-epileptic drugs are classified into 3 types based on the mechanism of action. Mainly one is the drugs which causes anti-epileptic drug which causes prolongation of sodium channel inactivation. One is prolongation of sodium channel inactivation. Sodium channel inactivation is the first option. In that, the second category, GABA chloride channel opening facilitation. Chloride channel opening facilitation of GABA chloride channel opening. And the third is inhibition of T-type calcium current. Inhibition of T-type calcium current. These are the different 3 type of class of anti-epileptic drug. This is very important. So the drugs coming under the prolongation of sodium channel inactivation is phenytoin, carbamazepine, valproate, lamotrigine, topiramate, zonisamide. All are coming under prolongation of sodium channel inactivation. This all drug causes prolongation of sodium channel inactivation. That is the mechanism of action of this drug. So one thing you have to remember, valproate. Valproate is very important. Here valproate has got all of these 3 action. That is, it causes prolongation of sodium channel inactivation and the GABA chloride channel opening facilitation of GABA chloride channel opening, and also it causes inhibition of T-type calcium current. So valproate has these 3 type of mechanism. And the other medicines coming under this one, facilitation of GABA chloride channel opening, GABA mediated chloride channel opening are barbiturate, benzodiazepine, vigabatrin, gabapentin, tiagabin. Valproate is also there. In case of inhibition of T-type current, calcium current, ethosuximide, trimethadone and valproate. So here you can notice that valproate is coming under all this category. And one more thing, you have to study this one. This is very important questions. So you have to study each and every drug here in this classification. For this I made a simple trick. You can see here, for the prolongation of sodium channel inactivation, I am saying, you can see PC laptop zone. PC laptop zone. P for phenytoin, P for phenytoin, C for carbamazepine, L for lamotrigine, T for topiramate, zone for zonisamide. P for phenytoin, C for carbamazepine, LAP for lamotrigine, top for topiramate, zone for zonisamide. Valproate is coming under all the class. So valproate is also coming here also. So this one, PC laptop zone, phenytoin, carbamazepine, lamotrigine, topiramate, zonisamide. All are causes prolongation of sodium channel inactivation. The second type, GABA chloride channel opening. Here we know valproate is there, but all other medicines we are not studying here, but we will study this one. This is also little bit 5 or 6 drugs are there, so we are not going to study. We will study this and prolongation of sodium inactivation as well as inhibition of T-type calcium current. So the medicine, if it is coming, the this drug which is not coming under these two category, it will go to this GABA chloride channel opening. But you have to remember that valproate always coming in all 3 category. So here inhibition of T-type calcium current is, one is ethosuximide, and the other one is trimethadione. These two drug is there, and valproate is also there. Ethosuximide, trimethadione, and valproate causes inhibition of T-type calcium current. PC laptop zone causes prolongation of sodium channel inactivation. All other medicines, all other anti-epileptic drugs causes GABA, facilitation of GABA mediated chloride channel opening, that is barbiturate, benzodiazepine, vigabatrin, gabapentin, thiagabin. Now we will move to the next question. I hope you understood this mechanism. Why I took this much of time is this is very important questions. We will move to the next question. Question number 4. Question number 3 we already discussed. The question number 4, the drug of choice in case of trigeminal neuralgia. This is also important. Trigeminal neuralgia, drug of choice. The options are aspirin, imipramine, carbamazepine, valproic acid. The correct answer is carbamazepine. Carbamazepine is the drug of choice in case of trigeminal neuralgia. After discussing all the MCQ, we will see the drug of choice in last. We will see in the next question, question number 5. The following statement is not true of carbamazepine, regarding carbamazepine. Not true regarding carbamazepine. Option, it generates an active metabolite. Correct. The second option, its plasma half-life decreases to nearly half of the original value after chronic use. That is also correct. It is being used in mania. It's also correct. The fifth question, option D, is it is not effective in complex partial seizure. The correct answer is for this question, that is, which is not true regarding carbamazepine, is option D. Actually, carbamazepine is effective in case of complex partial seizure. CPS. Question number 6. Select the drug having a narrow spectrum anti-epileptic activity restricted to absence seizure only. Options are lamotrigine, ethosuximide, sodium valproate, primidone. The correct answer for this 6th question is ethosuximide. Ethosuximide is used in absence seizure and it's also it's a narrow spectrum antibiotic. Anti-epileptic. Lamotrigine and valproate also coming under its they are broad spectrum anti-epileptic drugs. Next question, question number 7. Sodium valproate has shown to option prolongation of neuronal sodium channel inactivation. This is the mechanism of action. The question is asking for the mechanism of action of valproate. We already studied this one. It's acting through 3 type of mechanism. One is sodium channel inactivation, prolongation. Next one, attenuate T-type calcium current. The third option, inhibition regression of GABA by GABA transminase. These all are valproate mechanism. The correct answer is option D, all of the above. Next question number 8. The sodium valproate should be used with caution in young children because they are particularly at risk of developing following adverse effect. Options are hepatitis, loss of hair, anorexia, tremor. Sodium valproate should be used in caution in young children because they are particularly at risk of developing of the following adverse effect. The options are hepatitis, loss of hair, anorexia, tremor. The correct answer is hepatitis. Guys, one thing you had to check it in the first question, I think. No, in the second question I told you here it is less than 3 years. This is not like that. This is in the normal in children only. It's not particularly told in less than 3 years. This is wrong. Here it's come the question actually in hepatitis. This is the case. Here it is less than 3 years. Hope you understood this one. That one is not correct. This 3 years is not correct. So this is it's just generally mentioned in children only. It's not mentioned any particular year. This is here mentioned sodium valproate, especially in less than 3 years old, will cause hepatitis. Valproate will cause hepatitis, especially the children is less than 3 years old. Next question number 9. The preferred drug for suppressing febrile convulsion. The preferred drug for suppressing febrile convulsion. This is also drug of choice question. Options are intramuscular phenobarbital, IV phenytoin, rectal diazepam, oral sodium valproate. The correct answer for this question is rectal diazepam. Drug for suppressing febrile convulsion. Next question number 10. Clobazam is a benzodiazepine used as. This one we already discussed. The name is already discussed in the chapter sedative and hypnotics. In that diazepam or class benzodiazepine is classified into 3 categories. One is anticonvulsant, one is hypnotic, one is anti-anxiety. So here in that clobazam we already discussed is coming under option hypnotic, muscle relaxant, anxiolytic, anti-epileptic. The correct answer is anti-epileptic. Next we will move to the next question number 11. Gabapentin acts. Option A as a GABA A agonist, as a precursor of GABA by enhancing GABA release by GABA independent mechanism. Gabapentin mechanism is through by enhancing GABA release. The correct answer is enhancing GABA release. Now another question. Select the anticonvulsant drug that act as GABA transaminase inhibitor. This is also important. GABA transaminase inhibitor. Option gabapentin, vigabatrin, lamotrigine, clobazam. The correct answer is vigabatrin. Vigabatrin is the correct answer here. Next question. The last question of this is the second last question. After that we will discuss the drug of choice also. The question number 13. The risk of neuronal tube defect in the offspring can be minimized in pregnant women receiving antiepileptic by supplemental therapy with neuronal tube defect can be minimized in the pregnant woman by the supplemental therapy with options folic acid, vitamin A, vitamin E, pyridoxine. The correct answer for this question, question number 13 is folic acid. Folic acid supplement therapy will decrease the risk of neuronal tube defect. Spina bifida is one of the important adverse effect of valproic acid if it is used in the pregnancy. This is one important question. Spina bifida is caused by valproate in the pregnant woman. If pregnant woman is using valproic acid, it will cause, there is a chance for causing spina bifida. Now we will move to the question number 14. The preferred drug of choice for status epilepticus. Status epilepticus is options: IV diazepam, IV phenytoin, IM phenobarbital, rectal diazepam. The correct answer is IV diazepam is the correct answer for status epilepticus. Now we will see the important drug of choices of different type of epilepsy. Here we studied generalized tonic. Generalized is classified in GTCS: absence, atonic, myoclonic, infantile spasm, and partial C is simple partial, complex partial, and secondary simple and complex partial seizure. This one we already discussed in the second question. I think no, in the after first question. Here you can see in case of GTCS, that is generalized tonic-clonic seizure, as well as simple partial seizure and complex partial seizure. These three categories, GTCS and SPS and complex partial seizure. For this drug of choice is carbamazepine is the primary drug of choice. Carbamazepine. You can use carbamazepine or phenytoin. Carbamazepine and phenytoin you can use, but one phenobarbital is there in case of in this case generalized tonic-clonic seizure or simple partial seizure. You can use phenobarbital as a second choice drug. The only option for phenobarbital which is using as anti-epileptic case is GTCS or simple partial seizure. That is also not primary, not first choice drug, and it is second choice drug. For the first choice drug for GTCS, SPS and CPS is carbamazepine and phenytoin. Carbamazepine is the first choice drug. Now we will move to the next type, that is absence seizure, then atonic seizure and myoclonic seizure. That is these three categories. The medicine of choice is valproate. Valproate is the first choice drug for these three categories: absence, atonic, myoclonic. And the next one you have to study is febrile seizure. This one we already discussed. Febrile seizure, diazepam through rectal diazepam is the first choice drug for the febrile seizure. Then last one is status epilepticus. That is also we discussed in the last question, I think. Epilepticus, status epilepticus is same diazepam, but it is IV diazepam is the status epilepticus. Febrile seizure, rectal diazepam. Hope you understood all these things. If you think that I am little bit speedy, you just pause the video and try to study that one. And if you don't know this thing, make sure you have to write it on note and study that one very well. Hopefully you will get a good mark in the coming exams. Thank you for watching this video, and don't forget to support me through subscribing my channel. Thank you.